Here my colleague musician, we're from Health Intervention and Community Assistance Program, HAP in Thailand. We are here to present our part of our work, which is funded by the Visual Artists Initiative. So the next 8 to 10 minutes, we're going to talk about the background rationale of the road traffic accident project, the overview of our study, how do we come about to conduct this study, the study methodologies, and some of the preliminary findings that we have received so far, and the plan for the next step. At the end of this presentation, we would like to ask you for some questions, so please let you ask me. Let's start with the UN General Assembly. Declared the date of action in October 2021 with the target to prevent at least 50% of the road traffic deaths and injuries by 2030. So with that in mind, I'm sure everyone in this room understands the impact and the cost of traffic incidents is not cheap. And in Sri Lanka, more than 1 million people are hospitalized in care from injuries, with transport injuries being the leading cause of hospitalization, thus the major cause of injury-related mortality. Increasing as population, communities, accident causes, and alcohol is increase the severity of the road traffic accident in China, according to the traffic data. Economic cost is high due to the crowd, the treatment cost, and the loss of productivity by the victims and families. With that initiative in Sri Lanka, we were commissioned by the ATLS Sri Lanka to conduct a rapid assessment of the road traffic injury related to policy and the economic impact in Sri Lanka. The main objective that we would like to understand, we would like to determine the trends of the road traffic accidents in Sri Lanka based on the availability of data that we have. Second point, we would like to understand the vehicle insurance regulation, regulators, policies on the casualty care and emergency service provision related to the reimbursement. We would like to also draw upon the Thailand's experience and other country experience in improving services delivery to impact post-trauma care and lessen any best practices for Sri Lanka. The timeline for this research is relatively short, which is only 3 months, from October last month to December, the end of next month in 2023. But with this short timeline, we would like to achieve this lesson learned based on the best practices of the countries. We would like to understand the current state in Sri Lanka, and hopefully these evidences will generate some evidence that will inform the policy makings in terms of policy recommendation at the end of this study. So the next part is going to be the result of the database review that we have conducted so far. So based on the time that we have conducted some database review to identify any fields for integrated and timely intervention for road traffic accidents in Sri Lanka. And many things have been highlighted, but some of them are highlighted here, which is the implementation of any integrated trauma care system is important to reduce morbidities and mortality related to RTA. Any effective pre-hospital care such as proper first aid care and transferring patients to trauma center within 4 hours is also relatively important. It has to be emphasized that a well-connected pre-hospital care with hospital services provide appropriate referral system and reduce any admissions. Last but not least, the data system or the trauma registry is rather important to develop an effective and integrated trauma care system, which the next part, my colleague here is going to talk about the data analysis based on the data set we received.
First is a massive overview. We use the second data to describe the road traffic accidents in Sri Lanka. The main data is road traffic accidents from 2010 to 2022, and also another 2 data we also use in this study. The primary outcomes is the 5 severity levels, and also was a data analysis conducted in our software. Let's switches the preliminary results. The results, including 5 parts and were presented by diagrams. First is the road traffic accidents in Sri Lanka in the past 12 years. From this figure, the first thing we can find, an overall trend is decreased, especially in the number of the damage, fatal, and the deaths. A significant year is 2018 to 2020, where the severity levels is damaging was decreased rapidly. Second, from the road traffic accidents by the division, we can find a general decreased trend from southwest to northeast, and then we also found 2 cities that are the most severe. Next, from the perspective of the vehicle causing the fatal accidents, we found motorcycle was the primary type for the fatal accidents in the past 3 years, and furthermore, the motorcycle list was the top number of the death victims, which more than other types.
That's interesting of data analysis result. But we are still collecting more details, and hopefully if any additional database has been identified, we will include that in our analysis. So after we collected data and conducting the analysis, we will synthesize all the important aspects and present it in the stakeholder consultation meeting at the end of this month. We would like to discuss this with the high-level officers and any relevant stakeholders in the locals of Colombo, Sri Lanka, to discuss potential solutions and discuss potential aspect of how do we leverage this evidence into policy implications. And hopefully by the end of this stakeholder presentation, we will be able to distill some of the essence from the stakeholder consultation meeting and include it in the report by the end of this month. So before we end this presentation, I would like to ask your attention to please scan this QR code to answer the survey. This survey basically will help our study to understand the national and international stakeholders in the field of road traffic accident in Sri Lanka. This information will be kept confidential and will be used only for the analysis. So it's only going to take less than 5 minutes, so please spare some of your time to complete this survey. And that's it for, thank you for all the attention today for this presentation. Hopefully we will see you soon in the Q&A session.
Bye bye.